Welcome to the office. Hola.
Hola, ¿cómo está?
Muy bien.
Nice
How
to
are
meet
you?
you.
How are you?
Good, thank you.
Okay. How are you, Mary? You're here from. You live here in LA.
Yes.
How can I help you? What are you doing here?
Well, actually, I'm having some problem in my back since like 2 months ago.
Okay. What happened 2 months ago?
I can't even remember exactly what happened, but it started like feeling a discomfort in my back in
Okay.
this area.
The middle of your back.
Yeah.
So she's pointing between her shoulder blades, the middle of her back. Okay.
Yeah, and it was really, really bad because at that time I couldn't even like my posture, and I had a tension on my shoulders, my neck, also my head, and I couldn't sleep.
So before 2 months ago, you had no back pain, no back issues?
Oh, no, not really.
No and not really are not the same thing.
No, the same thing because many years ago, when I was 15 years old, I had an accident with my auntie.
Okay.
She lost the control of the car, and then we impacted onto a wall, and the impact was on my side. And at that time, I had many problems with my back.
Yes.
But since then, no.
Your body has, I want to explain this, okay, when I go over your x-rays. Because you have some old injuries there. And I think what happened to you, Mary, is whatever happened 2 months ago, and I think it's, you work a lot, right?
Yeah.
You work a
Yeah,
lot.
I remain still.
And you're sitting a lot, and you're on the computer a lot. Are you drafting or everything is CAD?
It's CAD with the computer.
So everything is computer, so you're sitting a lot. And when I explain your spinal mechanics, and you're an architect, right?
Yeah.
So I'm going to explain this in terms of the building.
Okay.
And you've watched my videos, you've heard me explain it.
Yeah.
And I think it's going to make a lot of sense what's going on. So I feel what happened 2 months ago was a trigger of a process that was already going on in your body.
Okay.
I'll explain all of it, okay? And let's rewind now. You were 15, you got in a car accident.
Yeah.
Prior to that, growing up, sports in school, any slips, falls, anything major you remember?
No.
Okay, you sure?
Yes.
Okay. I'm going to have you ask your mom again.
Yeah.
Okay?
I'll
show you. Okay, and so then you had some yoga, you did some yoga, massage, acupuncture. You got any result whatsoever?
Oh, no, not really.
Okay. And I want to talk about this. This is really important because here what we like to do is we like to help people get an answer to what is the problem. You know, it's not just about, hey, I got some tension and let's, give me some treatment. For what?
Yeah.
Right? And the difference between getting a treatment and getting chiropractic work. So here we serve people, we serve chiropractic. And the work of chiropractic is getting rid of the irritation to the nervous system so the body can function.
Yes.
A treatment is something that's done, this is important, I want you to understand the difference.
The difference.
A treatment is done to the patient. A treatment implies that you should feel better when you leave. Otherwise, why did I get a treatment?
Yes.
Make sense?
Yeah.
Chiropractic is done for you, not to you. What does that mean? I find the pressure, I get rid of the pressure. Your body does the healing, not me.
Oh, okay.
Does that make sense what I'm saying?
Yeah.
So if your foundation is off and you've been compensating, which is what is your issue, so your mid-back, I'm going to show you, is not actually the problem.
Okay.
Your foundation is the issue.
Oh, wow.
That's the only issue going on? Anything else? Feet, knees?
Yeah, because in this leg, I can't stand for a long time because it bothers me from the knee to my foot.
Okay. Did you injure yourself?
No, I don't remember.
Okay. Only on the left side, not the right side?
No, not the right side.
And that started when?
And I having problem. No, is occasionally the
wrist?
The wrist, because I think the computer.
Are you doing a mouse, trackpad, or all keyboard?
Keyboard and mouse.
Mouse right side?
Right side.
Okay.
And this is for the key.
Workstation, seated or standing?
Seated.
Seated, okay, so we're gonna talk about ergonomics later.
Okay.
Okay, today we need to figure out the problem. I need to tell you and show you what your problem is.
Okay.
We start on the treatment today. We see a couple of visits.
Sure.
And figure it out.
Okay.
Okay.
Perfect.
So, mid-back, number one. Left knee and the wrists.
Yeah.
Both wrists.
Yeah, and I think my right feet is smaller than my leg.
What do you
I don't
mean?
know. It's normal.
You mean you're shorter on one
Yeah.
side?
No. My feet. I think.
Oh wow.
Yeah. I don't know,
Okay.
it's normal.
Check this out. Check this out.
I don't know. It's normal or not.
So come from the top up here. Look at this. Come up here. And you can see her right foot is actually smaller than her left foot. Okay. I don't know that I'm doing anything for that, but let's see.
Yeah, I don't know. It's normal.
There is normal variation in feet, okay? That the feet are not perfectly the same. The question is it just the feet that's smaller, or are the muscles, or is it smaller in the muscle on the right side compared to the left side? And really quickly, let's take a look.
Yeah, because I never saw one.
Let's take a look. This is the right side. So from the patella, we want consistency. So from the patellar tract, we'll go to number 5, go around, and the thigh here is what? 18.25. And from his patella, go to 5, turn around, and from here we have a little less than 18. So actually the whole thing is smaller.
Yeah, I didn't know that, but I just realized that I always when I buy some shoes,
Yeah.
I go buy some this.
You have to buy different size shoes? or
No, I just go based on this
On your,
left.
on the bigger one.
Yeah.
14. $14.25. No, that's fine. So the calves are the same. This is a little bit thinner than this. Okay, no problem. All right, you ready to get started?
Yeah.
Let's go over your x-rays. Come over here, please. This is our posture line. And in the posture, what we're doing is we want to make sure the ear lines up with the shoulder, the hip, the knee, and the ankle. With an x-ray, where we're taking the plumb line or the posture line and running it up. This line is supposed to pass here, ma'am.
Wow.
So what it shows us, your whole upper body, including your mid-back, is behind your foundation. So what do you think those muscles are doing just to keep you upright? Or you'd be way back here.
Wow.
So your mid-back, look, mira, you're back here. And then your neck is compensating and going reverse. And then you're sitting at a computer like this all day.
Yes. Wow.
And the end is.
Yeah.
All right.
Yeah.
Are we symmetrical? Do you see imbalances? Do you see things that are slightly off? Do you see that this circle is slightly different than this circle? This is your tailbone. This is your SI joint. This side is a little bit swollen. This side of the SI joint, there's a little bit of scar tissue here. But all of that is secondary. This is your answer, ma'am. Look, mira, aquí. It goes like this. You got a bend in your tailbone
Yes.
here. You see that?
Yeah.
Okay, let's go over your numbers. And the numbers confirm what I'm saying, so this should make sense now. And there's a lot of good news here too, by the way. So the first good news is your base is off by 2 millimeters. That's okay. Anything under 7 millimeters, discrepancy, so the hip can be different, 6 to 7 millimeters.
Oh,
No, there's
it's
no
okay.
problem. That's a normal variant. Yours is 2, no problem, no intervention. We have PIIN 1 millimeter. I'm not even so excited about that. But here's what I am. You see this P3? So, and you see this 2 minus here on the right?
Yes.
So here's what's happening. Your sacrum of your foundation is gone back on the left side and tilting down. That's a fall.
Wow.
That's an old tailbone injury. Okay? So you ask mama, that's why I asked you, do you remember anything? So your tailbone is doing this. It's back and it's down. And that's throwing off the mechanics of the whole body. So you see the tilting does what? It causes your whole spine to do what? Go to the side.
Yeah, like, yeah.
Do you see it now?
Yeah.
Okay. And you're complaining of here, so what is the body doing? If the body didn't compensate in the mid-back, then what? You'd be tilting to the side. So where you're experiencing pain is the compensation to the foundation.
Oh, wow. I'm like,
Like pizza.
Yeah,
you know,
yeah.
You know pizza? Not pizza, like pizza. I'm not saying it with a funny. Pizza.
Yeah.
Pizza. Okay, that's what's going on here, okay?
Oh, wow.
Next, let's continue up. So this curve then does what? It wants to go back to neutral, but it doesn't go back to neutral. It goes further to the left.
The left.
Okay. And then, let's zoom in. You had another issue. I think this was your car accident. You see this one here? This is numero dos, T2. You have a T2 side slip. So the T2 has shifted to the left side. You see this is the bone here? It doesn't line up here. So these bones should line up here. This one's shifted left. And that's what's throwing your neck out. Now, from T2, what happened to your jaw? You see?
Yes.
When you open, it deviates to the side. So we have a jaw issue. We have T2. We have sacrum, tailbone, and whatever I find in the middle.
Okay.
Does that make sense? Why are you doing this?
I don't know, like I'm trying to
You're trying to understand, or you're trying to remember?
remember.
Don't worry about it today.
Okay.
You're going to take your x-rays home with you.
Okay.
You can study them at home. You have a PC at home.
Yeah.
It's on a, you can just plug it in. Study your x-rays, look at it as an architect,
Yeah.
and then ask me questions.
Sure.
Okay? Cool. Now, let's continue. So that's the foundation. That's the sacrum is where we're probably going to start. Let's look at your side profile now. Let me give you a lot of good news. But before I do that, let me show you your tailbone. Mira, this is supposed to be straight.
It's not straight.
Mira, aquí, aquí. Okay?
Okay.
So, number one, we have to fix the sacrum. Number one. Once that is fixed, you see this L5? The tilt, you see how it's angled?
Yeah.
This angle tells me this is at least a 12-year-old injury, 12 to 15-year-old injury.
Yeah, maybe.
Whatever that, I'm talking of the low back.
Yes.
So all of these start to go back. And then you're curving a little early, but you're curving because it's trying to hold and it's trying to bring you forward. Your discs are good. These discs are all good. Your discs are good even though we have this reverse curve. Okay?
Okay.
What we need to see next is, let's look at the neck now. This is your normal curve. It should be going forward. 60-degree arc.
Wow.
Forward. Extension, you don't have a lot of extension. You actually don't have any extension here. You're still forward. Número 2, 3, 4, 5, 6, 7. So 7 is still back. 6 moved, 5 moved, 4, 3, 2 moved. This one is still slightly back. So now let's put it together. C7, T2, down in the sacrum, S3, around there. And then whatever we find in your mid-back.
Okay.
Okay?
Okay.
So we're going to see if she got the Oaxacan wiggle. I want you to walk to the corner and back several times. We're watching her dimples. We're watching her overall appearance. What I want you to see here is right side is higher, left side is lower. This is swelling, inflammation.
Oh, okay.
Okay? So if I do my job right, this is going to get less.
Hope so.
Yes?
Okay.
Then she has dishing in the spine here. I need you to come see this. Look. So this tells us a lot of information. When we look here, this should be coming out and then going in. This is swollen, this is straight, and then it dishes inside. So it looks like this is a hump, but it's not. This is coming from here, and this is part of your digestion. Okay? Walk. Walk, please. Go ahead and walk. And You're gonna walk several times back and forth, please. And do you move your arms when you walk?
No, not really.
Okay. Just regular walking. So when she walks, she does compensate and pronate quite a bit. You can see she has decent movement in the dimples, but she has a lot of swelling and she keeps wanting to go to the side. You see how you're going to one side? No?
So
You
go
keep-
like,
You're tilting to one side.
yeah,
You keep wanting to go that way.
in this side.
Yes. Go, walk again. Okay. Let's come over here. Stand over here, please. March in place. March like this. Face this way. March in place. Now, what we're gonna, you keep marching. My hand is here. Close your eyes. Close your eyes. So what's interesting in her case, when she's marching, she's holding it well, but she's going back a little bit. Most of the patients I've seen go forward. She tilts back to that right side when she does this. Okay, come over here, have a seat. Starting at the base, first thing we're getting, 15 points, base of the neck, C7. Neck is good. C7. 5 points, T2. Never had one that close together before, but it's always a first. Señorita,
Yes.
it's not coming from your mid-back. It looks like it's going to break there. It doesn't stop till, didn't stop till there. This is coming from this. So this is interesting. It's coming from there. S3, S4, down low. S3, S4, T11, 12, T2, C7. 1, 2, 3, 4. Those are the 4 majors I'm finding today, okay? Feet together, open and close your knees, open and close, open and close. Watch my thumbs, please. We're watching general motion of the sacroiliac joints, left side only. Left, open and close. Derecho solamente. When she does the right, there's shifting of the left side from that fixation of the left SI joint. Izquierda solamente. Sit back for me, please. Bueno. Left SI joint. Head down, please. Round your back. Round, round. Bueno. Static palpation. And what I'm going to do is I'm going to first work on the bottom stuff here. And what you can see is you can see all the swelling pool right here. ¿Duele?
Sí.
¿Mucho duele arriba o abajo?
Abajo.
¿Abajo o arriba? Aquí,
Ahí,
ahí, ahí, ahí. Ahí, 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 ahí. Número 5, 4, 3, 2
Yes.
or 1.
2.
2. Número 2. L5. Come back slowly in extension. Good. Número 1. ¿Duele?
Yes.
Sí. Número 2. ¿Duele?
Duele más.
3. Or 4. ¿Dónde le duele más? 2 or 3.
2.
2 or 1. 2. 2. S2 left side. L2, S2, T2. 1, 2. ¿Duele?
Sí.
1. No. 7. No. 2.
Yes.
¿Sí?
Sí.
Sit up straight. Okay. Now let's formulate our game plan, okay? Are you nervous?
Yeah.
Don't be
little
nervous.
bit.
Don't be nervous. T2, número 2. L2, lumbar. S2, sacrum. You ready?
Yes.
Let's do it. So, we're gonna start on S2 and T2.
Okay.
I'm okay adjusting a lumbar and a sacrum together, if we have to. But we're gonna see, maybe S2 will clear your L2 for today.
Okay.
Okay?
Okay.
Face down. Boca abajo. So, we're gonna do her sacrum. Uno, dos. We know it's rotated on the left, so we're gonna be on slightly on that left side. And we're gonna torque slightly counter. There it is. Relax the shoulders, please, down. Hi. You okay, Mary?
Yes.
Poco. Bueno. You okay?
Yes.
Bueno. Número dos. Now, we have a T2 side slip. It's side slip to the left. So the fix is we first have to be on the right side. Uno, dos. We're going to spin it from the transverse on the right. Look up a little bit. Look up, up. Bueno. Perfecto. Now we're going to take a spinous contact. You're a tough lady, yo. Relax down. Hands down. What? There you go. Okay. Bueno. Let it roll forward. Gotcha. Come up slowly. And I want you to walk back and forth 2-3 times. ¿Diferente?
Sí. Antes sentía como que sí me iba del... Ah, I'm sorry.
It's okay. ¿Qué es diferente?
I feel like more straight.
Keep walking. How's your mid back?
Better.
Right?
Yeah.
We didn't touch it. Sí. Siéntate aquí, por favor. Now, what I want to do is get a little bit more of T2. Número dos. This is T2 in the chair. A little bit more. Look up. Oh, no. All the way down, down. There you go. Siéntate derecho. Bueno. Let's rescope and let's see. Oh, va. Starting at the base. Seven and 2 are clear. Awesome. No kidding. L2 is clear. Sacrum is heat. Mira, all the way back. Diferente. Dos. Bueno.
Yes.
3, 2, 1, 5. Bueno.
Yes.
Mira.
Wow.
4, 3, 2. ¿Mejor? ¿Duele?
Un poquito. A little bit.
Little bit, right?
Yes.
There's no pressure there after the adjustment, so I don't want to mess around with that.
Okay.
You're going to do lots and lots and lots and lots and lots of walking.
Okay.
Boca-
Just walking?
Just walking. Boca arriba. Walking, swimming, hiking, biking.
No yoga?
No. Not
Okay.
right now.
Okay.
Please. Don't add any extra variables right now, okay?
Okay.
Walking, hiking, swimming. No biking, really.
Okay.
Walking and hiking, just walk.
Okay.
10,000, 12,000, 15,000 steps a day,
Okay.
okay? Ankle. Raise your left leg. Sit up and turn. Turn this with this. Now, ears. Shoulders. Walk 2-3 more times. As you're walking, should be even better.
Just I can feel it.
Huh?
I can feel it, the difference.
And the main thing I want us to get feedback on is your mid-back first. Because we didn't touch your mid-back, and that was your number one complaint.
Yes.
Bueno,
Bueno.
siéntate aquí. Now you get the buff and polish, okay? Five, four, three, two, extend it. Over here, squeeze my hand. Squeeze. Elbow, squeeze. Relax there. Relax there. Squeeze, aprieta. Aprieta. ¿Mejor? Okay. Why don't you share with us in español? ¿Qué diferente? En español.
En español, pues la verdad sí me siento diferente, puedo sentir la diferencia de cómo llegué en este momento. Estoy muy agradecida por la oportunidad de poder estar aquí con el Dr. Rahim. Ha sido un placer no solo conocerlo, sino la oportunidad de haberme atendido.
Okay, and we'll see what happens. We'll see you a couple more visits and we'll see what happens.
Sure.
Sound good?
Yes, perfect.
Any questions for me?
No, for now, no.
Okay, welcome to the office.
Thank you. Thank you so much. Nice to meet you.
Nice to meet you.